Did you know that sex and other related activities can sometimes lead to unexpected trips to the ER? From infections to injuries, today we're breaking down some of the most surprising sex-related emergencies I have to treat in the hospital. All right, let's dive right in. Number 10, priapism, aka the unwanted, prolonged, and painful erection that lasts for hours beyond sexual stimulation and sometimes even without any sexual stimulation to speak of. Priapism is an emerging condition often linked to the use of medications such as Viagra or injectable erectile dysfunction medications or treatments, or even things like drug use. What happens is the blood flow just doesn't go away in the usual time that it stays for. So in those cases, when the erection lasts beyond 4 hours, it becomes a medical emergency. That's because the blood in the penis can start to cause tissue damage, leading to permanent erectile dysfunction. To treat priapism, my colleagues and I inject medications into the penis to help reduce blood flow. And if that doesn't work, we may need to remove blood from the penis manually. Number 9, genital lacerations. No fun for anyone again, and these range from minor cuts to severe tears in the nether region. Lacerations like this can occur for a variety of reasons: mishandling sharp objects like razors or scissors, or they can also happen during rough intercourse or accidents involving sex toys. Often a lack of lubrication or inappropriate use of objects leads to these type of injuries. How does a doctor treat these sort of injuries in the hospital? Minor cuts usually heal on their own, or you might just need a few stitches, but keep in mind sutures often require local anesthesia injected into and around the area before stitching up, whereas more serious injuries might require going to the operating room for surgery. Number 8, rectal foreign bodies. Objects getting stuck inside the rectum are surprisingly way more common than you think. I've seen everything from fruits, light bulbs, water bottles, you name it. Usually these items are inserted for sexual pleasure, but can become lodged if not handled properly. The body is negative pressure, so once it goes too far, it basically gets sucked up in. So how does a medical professional remove said foreign body? Sometimes we can remove these things manually in the ER using a gloved hand, but unfortunately more complicated cases or things that have gone up too far need surgery to be removed. Number 7, fecal infections. Put simply, it's issues that arise like penile cellulitis or vaginal infections that often occur from cuts or abrasions that are exposed to fecal matter or other contaminants. This can happen during intercourse if proper hygiene is not maintained or if transitioning from anal to vaginal sex without cleaning. These infections are usually the result of bacteria, most commonly E. coli, entering the body through minor injuries. Signs of this type of fecal infection can include redness, swelling, pain, or discharge from the infected area. Early treatment with antibiotics and proper wound care is crucial to preventing complications. Sometimes hospitalization and IV antibiotics are even necessary. Number 6, foreign bodies in the urethra. The urethra is the tube that lets your urine leave your bladder and your body. For males, anatomically, your urethra passes through your prostate and into your penis and then out. Females, typically your urethra is much shorter. So any objects inserted into the urethra can cause cuts, serious damage, and infections, unfortunately. Treatment for this type of injury in the emergency department is first and foremost removal of the object. This is a very delicate procedure, sometimes needing anesthesia, and in more severe cases, surgery may be required as well. So a word of caution here. Please never insert objects into your body that are not designed for sexual use. Always prioritize your safety to avoid serious injury, especially in sensitive areas like the urethra. Number 5, broken penis. For all of you out there that just flinched, I know what you were thinking. You can break that? Well, to be clear about it, it doesn't actually have a bone, and it's not exactly the same as breaking a bone in, like, say, your arm. Rather, this injury is called a penile fracture and occurs when the tunica albuginea, a fibrous connective tissue layer that covers the penis's erectile tissues, tears open. I hear from patients that this usually happens during intercourse when the penis bends suddenly or forcefully. If you break your member, unfortunately, this is considered a medical emergency and can lead to a long-lasting dysfunction in that area if not treated promptly. Treatment typically involves surgery followed by maybe a few days stay in the hospital, and the fracture can sometimes take months to heal. Number 4, STIs, infections transmitted through sexual contact. Surprisingly, 1 in 5 adults in the United States have an STI. That's about 68 million people. How does one get these types of infections exactly? Usually, unprotected sex with an already infected partner can lead to various infections. So how do you know if you have a possible STI? Well, the most common symptoms are burning, itching, or discharge. However, some STIs, like chlamydia for instance, can be asymptomatic in a lot of people. So if you are worried that you have an STI, treatment depends on the specific type of infection, but it may include antibiotics or antiviral medications. Number 3, vaginal foreign bodies. Yep, objects inserted into the vagina that become stuck or cause injury. Definitely quite painful or worrisome for the patient, and it's not always why you may think. Although yes, this can definitely happen during sexual activity when objects that are, let's say, not designed for this type of use are inserted in and become stuck, but sometimes other non-sexual things like menstrual cups and tampons get stuck or lost, and left in too long can cause serious issues as well. Now, in terms of treatment, doctors do have to remove the item with gloved hands and tools, and sometimes imaging and anesthesia may be required as well. And if the object causes significant injury or it can't easily be located, surgery might be needed too. Number 2, testicular torsion. This is a serious condition where the spermatic cord twists, cutting off the blood supply to the testicle. If this happens, it's definitely a medical emergency that requires immediate surgery to untwist the spermatic cord and restore blood flow. Delay in treatment can lead to the permanent damage or loss of the testicle. You'll likely know if you have it because you will feel a sudden, severe pain in your scrotum and one of your testicles. The testes should be about the same size. If one side becomes quickly larger than the other, this can be a problem. Changing the color of your scrotum, especially redness or darkening, is a problem as well. Usually this sort of thing can happen spontaneously or as a result of trauma, exercise, or say during sexual activity. If it's not untwisted within say 24 hours, some experts predict only a 10% chance of saving the testicle. Number 1 condition that comes to the ER, a Bartholin's abscess. It's an abscess that forms when the Bartholin glands located on either side of the vaginal opening becomes infected, typically due to a blockage or bacteria getting in. These sorts of abscesses can result from bacterial infections, including those transmitted through sexual activity. Symptoms of this condition include a very tender lump down there, swelling, and redness. Home treatment may be enough, but in some cases, further medical treatment may be necessary. If someone comes to the emergency department with this, treatment usually involves draining the abscess as well as antibiotics to battle the infection. If you have any other questions about this sort of topic, make sure you drop them in the comments below. Also, check out my new supplement company called Life Happens. If you found this video helpful, please make sure that you check out this playlist right here and make sure you subscribe, turn on your notifications, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.